Welcome. Today I am here to talk about concussions within sports and a new blood test that has been invented and used to determine these concussions on hand rather than going to the medical facility. But first, we all got to talk about what is a concussion. A concussion is a trauma to the brain or head that causes you to either be fatigued, dizzy, lightheaded, nauseous. Yes, do concussions heal? They do. And usually, with the right treatment, which is rest, they will heal perfectly fine. According to Mayo Clinic, though, once a concussion has occurred, it does put the victim or patient at the potential to receive another concussion. But what more than sports gives people concussions? My personal favorite is motorcycle racing. And Moto America, which is one of the head motorcycle racing for America, has established a new protocol and starting with a blood test to determine whether the individual has a severe concussion or concussion at all or not, and whether they would need further medical attention or not. This blood test is invented by Abbott, a medical facility that studies in different methods to treat different illnesses or symptoms. Abbott has invented an on-hand blood test that will determine within 15 minutes if the person has a concussion and will they need further medical attention or not. How do you say this benefits anybody? Well, it saves on medical facilities, trip to the hospital, unnecessary scans, and everything else, which can become highly costly. Now, on average, there is about 4.8 million people that go to the emergency room in a year that all suffer from concussions, with 40% of that being from or pertaining to sports, rather professional or not professional. This test can eliminate and make triage for those symptoms a lot easier on the medical facility, the staff, and the person in general. An average CT scan costs between $5,000 to $10,000. Who has that? And it takes hours of resources to be able to perform these things. When a simple blood test can tell between two different proteins within your blood to determine if you have had an injury or sustained something going on inside your head. Now, concussions happen from blunt force to the brain or head that shakes it around or cause the fluids to be dislodged. This blood test would be able to tell it. Now, the first one, which has the most craziest name of all, both of them do, these proteins is called the Gall fiber acidic protein. The second is a ubiquitin carboxylturn hydrolyx L1, UCH-L1. These tests can be determined. The first one, the Gall, which is referred to as GFAP, will determine within 20 hours of the injury and determine the severity of it. Is it a large mass? Is it small? Has it raised these proteins levels up? The second one is the more quicker version when they come back from the blood work, which is determined between 0 and 8 hours. This blood test, which is now a protocol for Moto America, will introduce new technology so that you do not have to go to the emergency room every time if you're within a sport complex, because they could do it on hand and on site. The second will help the emergency room nurses and everybody else from being able to administer a simple blood test versus taking you down to CT and putting you into a room and, the whole drill that goes along with going to the emergency room. This is my speech on how to inform you of the new and improved blood test that will be coming out and in more handy and is being used in hospitals and on sport fields to determine if a concussion is needed in order to receive the proper medical treatment that is needed after an injury. I hope you enjoyed this. I hope this was informative to you, and I will be glad to answer any questions that you might have. Thank you.